All right, hello everyone. Welcome back to Unidos Unplugged, the podcast where community, culture, and wellness take the spotlight. I am your host, David Villarreal, Unidos contra la Diabetes Outreach Specialist. I'm joined today with my director, Moises Arjona.
Hello.
And we have a very special guest today. If you would like to introduce yourself, Miss?
Yes, my name is Monica Fuentes, and I'm a Wesley Nurse with Methodist Healthcare Ministries.
Awesome. So thank you so much for being here today, Ms. Monica. And if you want to just get a little bit into just your intro, what it is that you do there at Methodist Health, and just a little bit of background.
Yes, my name is Monica. Like I said, I am a registered nurse, and I have been a registered nurse for 27 years. I live in Brownsville, and what I do, I'm a Wesley Nurse with Methodist Healthcare Ministries, and what we do is we provide education to patients, to people. We want to educate to prevent disease. But of course, if they already have disease like diabetes, then we help them manage the disease. That's the most important thing that we do.
Cool.
Awesome. Can you tell us a little bit about the mission of Methodist Healthcare Ministries?
Yes, the mission of Methodist Healthcare Ministries is serving humanity to honor God. And what we strive to do is to help the least served. And that's our motto, that's our mission, that's what we do. Our focus is to provide assistance in finding resources for those that don't have access to any resources.
Okay.
Especially those that are uninsured. Mm-hmm. That's the population that we serve. Mm-hmm.
Awesome. And do you feel like maybe having that spiritual background backing y'all's mission is helpful?
Yes, it is. It is very helpful because when patients come, they usually come and they have not only the disease process that they're going through, that they have so many other things that they're dealing with. And when they come and they talk to us, they have this sense of, I guess, like I can unburden myself. And then, as a nurse, as in the healthcare field, we are not usually allowed to practice the spiritual side, but in this organization we do. And it's actually an important part that they encourage us to do because they want to focus on the patient health, spiritual, mental, everything. We want the whole aspect, take care of the whole aspect.
Right.
Awesome.
I think it's really important to look at that because one of the things that sometimes when we go to a typical doctor's office, you come in, you meet the MA or the MP or the nurse practitioner or the medical assistant. I'm using acronyms, sorry. And then you meet the doctor or vice versa, right? But we don't always get that sense of it's a rushed up. We're here to run in and run out. And I think with the Wesley Nurses, it's a whole different approach.
No. When they come to us, they come and they sit down and we ask them different questions, and those questions that we ask is that they open themselves and into, because we focus not only on the health, but also the mental, the emotional, which is a very important thing that a lot of people don't have the support. The emotional support, that they need to manage the disease or whatever it is that they're going through. Sometimes it's not only the disease, there's so many other things that they're dealing with, and we can help them with that.
Yeah. Right.
Y en nuestra cultura no hablamos de esos problemas de mental. Se los sentamos que no podemos desahogarlos con nadie, porque al mismo tiempo es como algo que se queda en la casa. Sí. Pero ahora la costumbre está cambiando un poquito, o sea, es en la forma en que se presenta ahora es explicar qué es el problema, cómo te podemos ayudar con eso.
Ahora que tocas ese punto, la salud mental es algo que hacemos a un lado, que casi no hablamos de eso porque hay un cierto tabú en eso, pero cuando viene la persona y yo veo que tiene necesidad de algo, yo le digo, tenemos consejería disponible para ustedes, es gratis, y no quieren. Porque es like, ¿cómo voy a ir a hablar con alguien? Pero les digo yo, a veces es importante hablar con alguien fuera de tu entorno familiar, de amistades, porque a esta persona tú le vas a poder decir cosas que no le vas a decir a tu familia, que no le vas a decir a tus amistades. Vas a poder descargar lo que traes con esta persona y te van a ayudar a manejar las emociones, el estado de ánimo que uno tiene y canalizarla en algún modo para beneficio.
Y
de
sin
la persona.
juzgarte, ¿verdad? Porque como
Claro,
vas con tu familia,
sí.
te van a juzgar de
Oh, sí.
volada.
Sí, ya sabemos todo lo que te van a decir, especialmente si vas con tu mamá.
Sí.
Hemos visto
Sí.
los TikToks donde dicen, ay, mijito, es que eres papá. Y no, entonces,
Yeah.
y no, acá no te vamos a decir esto.
Judgment free zone.
Judgment free
Yes.
zone. Total judgment free zone. Yeah.
Very
Yeah.
important, very
Yes,
important,
yes.
yes.
See. And Miss, and you guys are located where in the valley?
We are throughout the valley. There's Wesley Nurses throughout the valley, all the way from Brownsville, which is the tip of,
South Texas.
South Texas, all the way to Rio Grande City. And this is just the valley because Wesley Nurses are all throughout up into Bexar County.
Yeah. So
Okay.
there's 74 counties that MHM covers. MHM is Methodist Healthcare Ministries,
Yes.
MHM for short. Again, we use a lot of acronyms sometimes, but for those listeners who are not familiar, MHM covers 74 counties in the Rio Grande. Well, in the whole state of Texas, 74. But here we do have the Wesley Nurses, which we work with really closely in some of our projects that we do. So we appreciate that.
Yes.
Wow.
There's
And-
10 of us.
Okay.
There's 10 of us in
And
the valley.
and you did mention, you guys are big on serving the underserved. So how does that, eligibility, how does that come into play?
If you are uninsured and you need assistance with resources such as like diabetic resources, you can come to us. We don't ask for anything. The only thing that we ask is that you have a diagnosis of being a pre-diabetic or a diabetic. And if
Okay.
you have those diagnoses, then we can provide you the glucometer, the strips. We show you how to use it. We show you how to check your blood sugar, how to keep a log, and you bring that log to us so we can see and so the patient can see what their progress is. That is very important because sometimes they don't know. They check their blood sugar and they leave it like that. But if you keep a log, if they keep a log, then they're going to see where they stand and where they are. And then they're going to see like, oh, well, my blood sugars are really bad.
Yeah.
And then they start making changes. And then I have seen they come and their blood sugars are different. They're better. They're not the best,
Right.
but they are way better than what they were.
Yeah, improving. And it's hard if we never understood what a glucose number means, and A1C number means, and what's a fasting and non-fasting. And I think the biggest thing that we hear sometimes is, well, they put me on medication, but I don't feel good. Well, because your body's adjusting.
Exactly.
Your body's adjusting to all that.
And that's a big thing that happens, it's when you come and your blood sugars are sky high, imagine your body took all that time to adjust to having your blood sugars in the 300s. And then you start taking medication, you start taking care of yourself. What happens? Your blood sugars are going to go down and you're going to feel bad because your body is used to having blood sugars in the 300s and now you're having them in the 100s. And your body's like...
Because your body's actually regulating, but
yes.
you're not used to it.
Yes, you're not used
It's
to all
not
that.
normal. Go back.
It's not used to
Yeah.
having normal blood sugar levels.
Yeah, it's hard. It's hard.
Well, I want to stay on this topic for a bit. So, why is diabetes prevention such an urgent issue for the populations that you're serving?
As Hispanics, and here all the valley, almost everybody, I dare to say like probably 9 out of 10 are diabetics. And probably I will even say the 10,
Yeah.
because our food, we eat very well. Well, that's one thing, we eat very
Right.
well. But our food is so bad. It's fatty, it's loaded with carbohydrates, it's fast food, it's not good. We don't eat healthy, So that is a big thing, that causes us to have this disease.
Yeah, and it goes back to nuestra cultura. En nuestra cultura, con todos los expresamos con amor, con comida.
Sí.
Y alguien se muere, hay comida. Alguien se va a casar, hay comida. Nomás por qué, hay comida. Football game, hay comida.
Y si ya comiste
Sí.
y luego vas a otro lugar y te invitan a comer,
No,
pues
pero-
tienes que comer. Porque
Sí.
pues, ¿verdad?
Vas a
Te
quedar
están
mal.
invitando.
tío,
Right,
Vas a
yeah.
quedar mal.
Sí.
Ya no te van a invitar.
Bueno, quizás lo podemos decir en español para que a lo mejor alguien que está escuchando no entiende inglés. Quizás digan en español por qué ponen tanto énfasis en tocante del diabetes, ¿verdad?
El énfasis que nosotros ponemos en el diabetes es la importancia de prevenir esta enfermedad. ¿Por qué? Porque si tú tienes diabetes, vas a tener muchas complicaciones que vienen con ella. Todos conocemos a alguien que no tiene un pie, todos conocemos a alguien que está ciego, que está lleno de cataratas su ojo, problemas con los riñones, problemas con la presión, y todo eso va junto con la diabetes. Si tú cuidas la diabetes, vas a controlar otras cosas. A mí me gusta siempre decir esto, que la diabetes, la presión alta, el colesterol, y ahora vamos a agregar el hígado graso, que es algo que es muy común ahora, son como primitos que siempre están jugando juntos. Si tú tienes uno, pues probablemente van a estar los otros ahí también. Pero si tú te cuidas de uno, vas a cuidar los otros también, ¿verdad? Sí. Entonces, aquí la importancia es empezar a cuidarnos.
Right.
Si eres prediabético, pues prevenir la enfermedad más que nada. Sí. Y si eres diabético, pues hacer algo para mejorar tu salud, para prevenir enfermedades que vienen con esto.
Cuando ustedes se encuentran con alguien que está quizás en la etapa de prediabetes, ¿qué son los tips que le pueden dar?
Lo que yo hago cuando una persona viene conmigo y es prediabética, primero les enseñamos lo que es la hemoglobina A1C. Es lo que yo hago, ¿verdad? Entonces, para que ellos empiecen a conocer el número donde están y dónde deben de estar, ¿verdad? Y que este número puedes bajarlo. Si tú bajas este número, tú vas a controlar lo que es tu glucosa, ¿verdad? Va a haber un cambio en esto. ¿Y qué es lo que hacemos? Pues lo más importante es la dieta, que es lo que estamos comiendo, ¿verdad? Y siempre les digo, a veces no hay que ser tan extremistas y dejar todo, ya no voy a comer pan, ya voy a dejar la coca, no. Hay que hacer pequeños cambios, hacen la gran diferencia. Y si empezamos con pequeños cambios, pues se van a hacer más hábitos, se van a quedar ahí. Entonces es más probable que tú puedas controlar eso y que lo hagas parte de tu vida, versus que dejas todo y luego a los 3 días te vas a comer todo lo que no te comiste porque pues tenías ganas de comer algo, ¿verdad? Entonces, pequeños cambios.
Sí, y es lo que le dijimos a todos, no comiencen a lo loco y hagan eso, porque no te va a ayudar. Es más contra a lo que quieres hacer bien, porque cuando te digo que no puedes comer algo, lo vas a querer comer. Sí. Te da la tentación todo el tiempo de, ay, necesito esto. So, es mejor despacito y poquito y hacer esos cambios que hacen esos hábitos buenos. Pero también es como digo mucha gente cuando van a ir a hacer ejercicios, no se van al gimnasio y hagan 2 horas de ejercicios porque el siguiente día
ya no vas a querer regresar.
So, es despacito, poquito, media hora, algo leve y no muy pesado.
Y si le agregas a que tú estás haciendo cambios en tu alimentación y luego empiezas a hacer ejercicio y no tienes, como dices tú, que ir al gimnasio, empieza a caminar, ¿verdad? Yeah. Y es lo que sí le digo yo a mis pacientes esto. Mira, tú haces pequeños cambios en tu alimentación y luego sales a caminar, ¿verdad? Sal a caminar porque eso te va a ayudar tu cuerpo a tener movilidad, pero también va a ayudarte a despejar tu mente. Sí. Cuando tú estás caminando, entonces tu mente también empieza a abrirse, empiezas a pensar, sacar todas las cosas que traes ahí que uno no sabe, y también llegamos a lo mismo, que ayuda tu situación mental.
Yeah. Y como oigo mucho a Moisés que dice, ¿qué tipo de adicto eres tú? So, pregunta si eres adicto a tomar tu azúcar o a comértela. So, en su experiencia, ¿qué tipos de gente mira más usted? ¿Alguien que...?
La comida.
La comida.
Que comen, ¿verdad? Porque eso es. En realidad yo pienso que la diabetes tipo 2, y no es que yo lo piense, es que es la comida, es lo que comemos. Porque la mayoría de las personas, y estamos en una situación ahora que hay niños que tienen diabetes tipo 2. Sí. Y la diabetes tipo 2 viene de la comida. ¿Qué es lo que comen los niños? Los nuggets, la pizza. Sí. Todo lo que es comida rápida, eso es lo que comen. Y luego vamos a agregarle que comen toda la comida que le llamamos la comida chatarra, los taquis, los fritos, todo eso.
Bueno,
y eso es lo que comen.
A ese punto, ¿se puede alguien ser diabético póngale que esté comiendo papitas y todo eso, pero no esté consumiendo azúcar? O
Es que-
igual se desarrollan otros problemas, pero
Pero es que ahí está el asunto. Uno piensa que la diabetes solo viene por el azúcar.
sí.
Y no es cierto. La diabetes es lo que comemos. ¿Por qué? Porque comemos carbohidratos.
Ujú.
Es como el plato ideal debe de ser lo que es proteína, lo que es las verduras, lo que es un poquito de fruta y verdura, ¿verdad? Entonces, y eso es lo que les digo a los pacientes. Pero como nosotros aquí estamos acostumbrados, los hispanos, te vamos a servir el plato y te vas a servir,
Bien servido.
vamos a ponerle carne guisada, te vas a poner la carne guisada y luego le vas a poner frijoles y luego le vas a poner arroz y luego le vas a poner un poquito ahí de ensaladita, ¿verdad?
Sí.
Unos cuantos. Pero entonces le digo, o es el arroz, las tortillas.
Ay, las tortillas, sí, las tortillas.
Porque
¿verdad?
no usamos tenedor, usamos la tortilla.
Entonces digo yo, o es el arroz, o son los frijoles, o son las tortillas, pero estamos tan acostumbrados a comer todo eso en un plato. Y les digo, ok, así comemos. Si quieres comer así, pues que tu plato sea más chiquito, ¿verdad? No todo el platote, sino un plato más chiquito, le echas un poquito de todo y puedes comer. Esos son los pequeños cambios que yo digo que hay que hacer.
Y sabes que es bien cierto eso de, de los platos. Pues todos saben que I'm a bariatric patient, so ya tengo 17 años que me hice la operación, ¿verdad? Pero una cosa que los dicen también es agarrar un plato chiquito. Pero nunca piensas que, no, lo voy a agarrar, porque pues ya te cape. Si agarro un plato normal y le echo de comer, no me lo voy a acabar. Y si voy a un restaurante a comer, ordeno un plato, no me lo acabo tampoco. Pero lo que he notado, y lo he hecho en mi casa, es, me fui de los platos grandes, medianos, o ahora los chiquitos. Y es lo que como. Y fíjate que me siento lleno, no me siento más, no me siento que me da ganas de comer algo más. Ya llené, no me voy a servir otra vez porque llené con eso.
Sí, y es que eso es lo que hacemos nosotros. Vamos a suponer, vamos a comer y nos servimos el platote, ¿verdad? Para comer. Y luego estaba bien rico, ¿y qué vas a hacer?
Otra
Me
vez.
gustó, me voy a servir otra vez. Y no te sirves poquito,
No.
te sirves otra vez el mismo plato. Entonces, ahí está el problema. Entonces, si quieres
luego el
comer de
postre.
todo, un poquito. Ah, bueno, y todavía ni estamos hablando de eso.
No, y la otra cosa es que pues, normalmente les digo a todos, el cáncer nuevo es estar sentados. Ya no es
Sí.
fumando, estamos sentados. So,
Sí.
Nos levantamos en la mañana, nos vamos al trabajo en el carro, sentados, llegamos a la oficina, sentados, y luego nos vamos para la casa otra vez, sabemos que hacemos sentarnos a ver televisión y luego los dormimos. Y ya,
¿No hacemos nada?
No hacemos nada. Y el cuerpo nunca agarra ese ejercicio, pero sí comemos muy bien.
Sí. Es más, ahorita si tú vas a un restaurante, yo pienso que lo que te sirven está diseñado para que 2 personas coman de ese
Sí.
plato. Pero ¿sabes qué? No lo comemos.
Sí, sí, no, sí, es
No
muy
lo
cierto.
comemos y aparte de eso, pues te está costando y dices, no, pues no lo voy a dejar, me lo voy a
Sí,
consumir.
no, pues me costó dinero, me lo como. Sí, no, es muy cierto. Y muchas veces los da pena o los da vergüenza decir, no, es un plato de para 2 personas.
Sí.
Los da vergüenza. Si yo soy de vergüenza, no creo, ay, mira, que no quería
Oh,
gastar
like,
dinero.
sí.
Cutting the plate in half,
Sharing.
right? They're sharing the plate, right?
Oh.
But I hear, look at this one, doesn't want to have to spend his money and
Yeah.
stuff, right?
Sí.
Pero es que somos bien, somos muy orgullosos y penosos. No, hombre, no,
No,
somos una cultura muy
honestly, yeah.
curiosa.
Yeah.
Y luego deja tú, a veces también, si una persona se está cuidando y tú ves que se está cuidando, ahí vas a decir, ay, pues comer.
Sí, I'm a bully. I'm a bully.
¿Verdad? Y eso es lo que hacemos, todos lo hacemos. ¿Por qué? No sé, pero bueno.
Así
Es-
somos. Así,
es la cultura.
Es la cultura, así somos.
Ajá.
So, yeah, I think I'm guilty of that. I am 100% bully. And y luego si sé que estás en dieta o que te estás...
Peor tantito, ¿sabes qué te traigo un pastel?
Un pastelito, sí. Sí. No, hombre, esto...
So, en inglés o en español, pero lo voy a preguntar en inglés. What are some common misconceptions about diabetes that you frequently encounter?
Uno muy importante es el de que, ay, me dio diabetes por un susto muy grande. Ese es el que oigo
Sí.
bastante. Es que, ¿sabes qué? Se asustó que porque es que pasó esto en la familia y que no sé qué. Y yo me quedo like, no,
Yeah.
la diabetes ya la traías, nomás que
Bueno,
tal vez te resultó porque
Bueno,
te sentiste
¿y
mal.
por qué oye usted mucho eso? O sea, ¿por qué sale mucho eso?
Porque eso es lo que la gente cree.
dice.
Wow.
Eso es lo que la gente cree. Otra cosa que oigo mucho es, si ya eres diabético y te recetan insulina, ay, es que la insulina ya es lo último,
Sí.
¿verdad? Que ya, si ya estás en insulina, o sea, que ya estás en lo último de la enfermedad.
Yeah.
Y no es cierto.
No es cierto, no es cierto.
Hay diferentes medicamentos que se usan para tratar la
O
diabetes.
sea, pero lo hacen ver como que la insulina es
Mala.
que tienes el diabetes
Es,
peor,
es el
o-
nivel 10, ya se acabó.
Ya no hay nada que hacer por ti.
Sí.
Y
Ok.
no es cierto, hay diferentes medicamentos para tratar la diabetes y a veces a algunas personas les funciona una cosa y a veces
sí.
otra. No todos somos iguales,
Right.
todos somos diferentes y nos funcionan las cosas diferentes,
Correcto.
¿verdad? Pero tenemos, no, pues fíjate, es que a mí yo me tomé esto y me sirvió y que
Sí.
y la otra persona quiere el mismo resultado
Sí. Right.
y tal vez no lo va a tener.
Sí. Todo el tiempo digo en la mañana que te tomas un vaso de agua frío con 2 limones.
Con limón.
And I'm like, pero, yeah, like, no. I mean, para mí no es correcto porque te estás lastimando los
sí.
dientes, los linamos de los dientes.
Es que a veces también tenemos esa misconcepción de que esto es bueno, me lo voy a tomar
Sí.
y le voy a echar más limón porque si uno es bueno, pues
Sí,
dos
pues,
ha de ser mejor.
Sí, esa es mi forma de pensamiento.
Right.
Y no es siempre bueno.
Right.
No, yeah. Por eso les digo, si no te va a cambiar tu forma de pensar, entonces tómatelo con un pipote, pero no lo hagas switch en tu
Exacto.
boca porque te vas a lastimar los dientes.
Sí.
Okay.
Bueno, en ese punto también, ¿qué son unos de los, I'll say it in English, what are some of the biggest barriers to diabetes prevention and care that you're experiencing in our region, in the valley?
Lack of knowledge.
Mm-hmm.
You know, lack of knowledge, lack of education, because even if there's a lot of information out there, people, it's different because when they come and they sit down there in front of you, it's easier to teach them and for them to pay attention to you. Because we give out flyers, we give out this, and people just glance at them, they see them, but they don't really pay attention. When they come to you, especially one-on-one, you know, because sometimes if it's a lot of people, yeah, they'll pay attention, but when it's one-on-one, they slow down and they ask questions.
Yeah.
And that's important.
Do you ever feel like a lot of people just kind of brush off how serious diabetes really is, like having diabetes?
Yes. They come, I've had patients come in and they've been told that they were a diabetic like 3 years ago. And barely they're coming to me like, because they feel sick.
Mm-hmm.
So let's see how they are. But they were diagnosed 3 years ago.
Yeah.
And they didn't do anything, you know. So imagine they must have not have been feeling very good for them to come in and say like, bueno, pues ahora sí me quiero cuidar.
Now it's time before
You
it
know?
gets too late
Yes.
because they're already feeling bad or they
Yes.
saw something. I think it's really hard, especially in our culture and in anybody's culture, not just in their Latina culture, but I think it's hard when we get diagnosed with anything, you know, like tell me what level I'm at, and when I'm at the last level, then I'll worry about it. You know, well, we don't have that because everybody's different. Like as you mentioned, some of us might start feeling nerve damage in our feet. Some of us might start experiencing blindness, numbness in our hands. It just varies with everyone, right?
And once you start feeling once you start having those symptoms, that means that your diabetes has been in your body for a long time. It's already caused damage.
Damage, yeah,
You know,
it's
so
really hard.
you don't want to get, and that's why we tell the people, you don't want to get to that point.
Right. And I think that's the hardest part for people to understand. And we try different ways. We were at a health fair the other day that we did just at a housing authority in Mercedes, and we tried to get everybody to get their A1C tested. Everybody did except for one person, and it's not. And I was like, "You're making me feel bad. They're gonna fire me. Everybody's supposed to get tested. Y como sea no se quiso hacer a test." And I'm like, I wonder why she didn't want to get tested.
Because she probably knew. She was scared.
Well, yeah, but at the same time, I mean, it's free. Get the knowledge, and if you don't want to do anything with it, at least now you have a reference point for the next time. But I think you're absolutely right. They're afraid, and we become creative because we talk to guys all ages stuff, and we try to say, if you don't want to do it for yourself, do it for your family. And they're like, well, no, my kids are already grown up. I said, you want to see your grandkids?
Yeah.
Or if they say they have small children and they're working and they have time, I go, well, then you're gonna miss work because it could have been prevented.
Yeah. You're gonna start getting sick. You're
Right.
gonna start having other things, the other complications that
Right.
we usually tell them about to prevent.
And as you mentioned, if you have diabetes, you most likely have fatty liver, cholesterol, high blood pressure, and all that sort of stuff. And it's a snowball effect. Once you start with one, they're all going to be rolling with you.
Exactly.
And we need to take care of them because they're right. I like the way you expressed it. They're cousins.
They're
Rodney?
cousins
Yeah.
playing
I hadn't
together.
heard that.
They're cousins. We have to use that analogy.
Yeah,
now.
that's good.
They're
I hadn't heard
cousins
that one.
playing together.
You know, like when we're little y que vienen todos los primitos
Yeah.
están jugando. Bueno, that's the same
That's
thing.
the same thing. Yeah, I love that analogy.
Well, with how much you guys do, I'm assuming you guys stay pretty busy. Can you just maybe walk us through what a typical workday looks like for you?
Usually, the patients that come to me are referrals. I get referrals from clinics, sometimes even from the hospital. They call me from the hospital that they're admitted because their blood sugar levels were very high, and they give them a flyer and they call me. So I schedule patients. Sometimes I have walk-ins, but usually I prefer scheduling them because that way I can give them the time. And when the patient comes in, I provide them with the education, then I give them the glucometer, I show them how to use it, and I want to see them use it. They check their blood sugar in front of me so I can know that they know what they're doing. And then I tell them, where they need to write it, and I give them an appointment for the next month. If they come the next month, and if they keep coming and bring the log, I will give them the strips continuously.
Oh, that's great.
Because we should call them, but if I need to be hunting you down to give you the strips, no. It's a give and take. You will have to put your part as well, and that's sometimes I get 2 or 3 patients per day. And I also go out and provide education out in the public.
Okay.
So provide a small health class in different places, and that's what we do.
Cool. And you know what? I was going to say it earlier, and I just completely forgot. But before I forget, and only because we do have this year, in the last, we've created a diabetes prevention and diabetes self-management education incentive kit. That's available to our partners, and because MHM is a partner, y'all are partners. We have these kits available to y'all, and what comes in the kit, and I'm not gonna remember all of them, but of course, there's always a UCD decal. That's the number one thing. Promote UCD.
Our logo.
We have a weight scale for a person. We also have a food scale, so you can measure your portion. Because sometimes we do a lot of education and say you have to have a 4-ounce piece of meat, right? Yes. And sometimes people say, well, whatever fits, it's a. But
I know
my palm and your palm is.
That's one thing that I teach my patients because I usually try to give them a sample meal plan just so they can guide themselves on what they're supposed to eat. And that's one thing I tell them, for your protein, it's better if you weigh it because and I show them my hand and then their hand, it's very different. So it's better if you weigh it. It's 2 or 3 ounces, I think, of protein per meal.
And then we have the measuring cups for dry and wet because there's a difference. Yes. And then we have measuring spoons in the same cup, and then we have a little lunch box, and then we have a blood pressure cuff, and then we have the exercise band. And we even have the diabetic socks because we want to work. And they're white. And somebody asked us, why are they white? Well, because if you're bleeding or you already have something, that's how you're gonna know.
That's how you know.
So we have these kits available. Oh, and they have a nice little bag.
We have the little for your pills.
Oh yeah, the pill boxes too. The pill box for a week and stuff like that. So again, we have these items at UCD to help our partners doing the work in the community help their patients or the participants in what they're doing. So we have those available if you ever need them. We'll share that with you. And then I think we try to figure out what the best practice is. Sometimes you give them to them as they need it, or sometimes you say, you know what, after so many sessions of whatever it is, you get the whole kit. But it really is up to what works and what the patient needs at that time, right?
It also involves a responsibility on the part of the patient.
It does.
It does. We have a lot of people that just want to come and get the things just to get them. But that's not the point either. Right. We want to see changes. We want to see them better themselves.
Right. And I'm all for it. I agree with you. You have to have that human agency to say, I need to make this change. I need to do it. If I'm going to be hounding you down all the time, you know what? There's so many other people who need my attention and are willing to work on it. And we need to change people from that mindset also of, you're right. We don't want to just give things away because we already modeled and controlled that for people, saying, hey, you go over there, they're giving away X, Y, and Z, and they go. But it's just to go get the items, but
Yes.
they're not doing anything with them. So we've changed our strategy too. We leave it up now to the partner who says, you know the population, we can provide you with these, but you distribute as needed, and we don't make it public to everybody. Because can you imagine
Yeah.
how many people are going to want glucometers
Yeah.
right away?
Yeah, and
Yeah.
and that's the thing. I mean, why do you want the glucometer if you're not going to use it or
Right.
you're not going to take care of yourself?
Right. And again, it's one of those things where we tell people, we have the glucometer for you, just email me, and
Yeah.
we'll get it to you. And if they never email me, pues entonces then you really
Because
didn't.
I've had a lot of people that they make appointments and I'm gonna go tomorrow, and tomorrow comes and they don't
Right.
come and they never come, but they keep calling.
Same.
But if you don't come, I'm not gonna.
I can't help you, right?
Yes.
Yeah, so I'm all for human agency. You need to make that change. You need to make it when you're ready, but we're here for you. And that's what I tell everybody, we're here for people if they need us. There's only so much we can do because I can't go hunt you down all the time. I just can't.
And also, it's a personal thing that they have to do. I
They
mean,
have
we're
to.
not gonna make them eat better. We're not gonna make them check their blood sugars. We're not gonna make them do anything that they don't want to.
They don't want to. Okay, sorry, we diverged
No,
into
no,
a
no,
whole other
it's fine.
section of
It's
agency,
totally
right,
fine.
and responsibility. I think, but that goes back to being good stewards of the funding that we receive,
Mm-hmm.
good stewards to following our missions are as well. Be servant leaders, but also you have to meet us halfway there.
Yes.
So just, I guess maybe like a random question, since you were on the topic of patients, is there any interesting patient stories that you can maybe share with us? They could be funny, sad, happy.
Actually, I have a success story from a patient that he came to me, and he's one of them that said that, he was a diabetic 3 years ago.
Okay.
And he never did anything. So he came to me because his hemoglobin A1C was, I believe, I don't know if it was an 11 or a 12. I don't recall at this moment. So I told him, he was a young man. This thing was funny. He was a young man, and I told him, you need to take care of yourself, because if you don't take care of yourself, you're going to have so many complications. You are already having complications because he came to me because he needed an ultrasound of the liver. So that means that.
How old was he?
I think he was 40.
Yeah.
So I told him, you don't want complications. So he had a girlfriend. He came with his girlfriend, and she was pretty athletic. And I helped him with his medications, and then I helped him to go have a liver scan, for free, the ones that they're doing. And yes, he had fatty liver. So I gave him the glucometer. I taught him how to use it. I gave him the sample meal plan. I told him that he needed to exercise. So he left. Okay. So then, he would call me and ask me questions here and there. And okay. So he comes back 3 months later, because he needed a replacement of his medications. So when he comes back, he is visibly slimmer.
Oh.
He had muscle. And then he told me that his hemoglobin A1C was 7.
Oh, that's great.
So, and I saw him, and I saw that he was proud of himself, because I'm sure he felt better, and he knew that he looked better.
Yeah.
So those changes. So I asked him, so what did you do? And he said, well, I just started changing my diet, and I started exercising. That's all.
That's it.
And then he said that he took it upon himself to go again to have that liver scan, since it's for free at the STRI. And he said that even the tech there told him, like, hey, what did you do? Look, because it's a big difference from
Right.
from your first scan to this scan. 3 months only.
Wow. That's crazy.
So
It really is that simple.
Yes, just diet.
We
and
overcomplicate
exercise.
it sometimes.
Yeah,
We do.
if we just monitor portion control, I think we'll be okay.
Yeah.
Awesome. You got anything else, Moses?
No,
You
I think we're
wanna-
good. We've done a lot. We've asked a lot of questions. I think we're good.
Right.
It's good conversation.
Just maybe one more, and before we can begin closing out here. So, is there anything you wish more people would know about the Wesley Nurses that we haven't covered?
The only thing I want people to know is that we are here to help them. If it's in our hand to help them and to do for them, we will.
Awesome. So, our closing question, we do it with every guest that joins us, is what does success look like to you?
Success to me is doing the right thing.
Great. Awesome.
Straight answer.
Straight answer. Whatever the right thing means for her.
It's the right thing for everyone.
Right. No, that's awesome.
That's good. That's good.
So yeah, before I wrap up here, do you want anything that you guys may have coming up, anything that you want to plug or talk about before we wrap it up, or where people can find you again, just a refresher?
I'm in Brownsville.
Okay.
I'm in Brownsville. My address is 1225 Boca Chica Boulevard. We are housed in churches.
Okay.
We're not part of the church, but that's where we are housed. So I'm in the First United Methodist Church in Brownsville.
Cool.
All right, awesome. On that note, we just want to thank you guys so much for joining us today on another episode of Unidos Unplugged. We hope you enjoyed it, and we hope to see you in the next one. Thank you.